Dr Rigby has been here at Royal Brompton for many, many years. So as you can imagine, he has a huge number of stories, and so it was a real pleasure to hear him take us through that journey. And I, for one, just wanted to sit and relax and listen to him tell his stories and think about the lives he saved and the families around them. And personally, I just felt part of his world for the time that I sat and listened to this amazing man and what he's done. So if you have a minute, if you have 10 minutes, treat yourself, sit back and enjoy it. Or if you really haven't got time, do it while you're cooking or ironing or gardening, because this is a story from Dr. Mike Rigby, which is like no other, and I don't want you to miss it.
I'm a consultant paediatric cardiologist at the Royal Brompton Hospital, although I also work with some young adults with heart problems that they've had since birth. And I'm here today actually to discuss with you the biplane imaging X-ray system for the cardiac cath lab, which we're looking to purchase. The cardiac catheter laboratory is used often now for performing types of keyhole operations. We call it interventional cardiology, but basically it's operations without opening the chest and usually done through veins and arteries in the legs or perhaps in the neck, occasionally in the arms. And for that we require very precise imaging of the heart and also the blood vessels in order to perform these complex procedures. When I first started at the Royal Brompton over 40 years ago, you can imagine that the imaging equipment was quite limited. At that time, anything we did was fraught with difficulties because of the very poor imaging quality. People might well ask, what is the difference with the new biplane lab facility and what you've been using in the past? Well, the difference is predominantly much greater resolution and bigger screens that we can view things through with that high resolution. It also allows what we call image integration. So it's not only X-ray imaging, we can integrate cardiac magnetic resonance imaging with CT imaging together with the X-ray imaging to produce spectacular three-dimensional constructions, allowing us to perform complex procedures which would have been very difficult to perform before without access to this quality. I can give you an example of a use of the cardiac catheter laboratory for treatments. A few months ago, a baby of just a few weeks old eventually arrived to see us because she had been very breathless, not putting on weight, and the mother was concerned and had taken the infant to several people, and no one had come up with a satisfactory answer for the baby's problems. In fact, the baby came to the Brompton and I was able to make a diagnosis of, at that time, what we call cardiac tamponade, which is a life-threatening condition where fluid accumulates around the heart, compresses the heart and stops it beating. So the baby was in a pretty dire state. And as an emergency, we took the infant to the cardiac catheter laboratory and I inserted a drain into the sac around the heart which contained all this high pressure fluid and drained it off. I had to leave the drain in situ because I expected the fluid to continue to accumulate. In fact, after 2 weeks, the drain blocked with kind of sludge from inside the sac around the heart, and I had to change that. Quite difficult when there's not much fluid there, but that required really excellent imaging to do it, and it was quite a struggle. Having put in the second drain, then after another 2 weeks, the drainage finally stopped. And after 5 weeks in hospital, this infant weighing not more than 4 or 5 kilograms was allowed to go home. Some newborn babies may have a severely obstructed valve, and then through the artery in the leg, or perhaps the vein in the leg, we can advance a so-called balloon catheter across the severely obstructed valve and blow up the balloon and tear the valve so that it no longer has a severe obstruction. We even sometimes have a completely obstructed valve and have to burn through this with what we call a radio frequency wire. It's a hot tipped wire, rather like a laser, but a little bit less dangerous, and we can burn through the valve to allow us then to dilate the valve with a balloon. But all this is done via the vein in the leg. Again, a life-saving procedure with miraculous outcomes. The other things that we can do, for example, are to close holes in the heart using umbrella-type devices. And these we can use in infants who are 4 or 5 kilograms if necessary. And also sometimes we might want to keep a blood vessel open by putting a stent in it, which will allow normal blood flow to the lungs or around the body. The other marvelous thing that we're now able to do in older children and in young adults, teenagers, is to implant new pulmonary valves through the vein at the top of the leg, sometimes through the vein in the neck. And this avoids major open heart surgery to replace the pulmonary valve. And instead of having to spend 7 or 8 or 10 days in hospital, it's basically an overnight stay to recover from the valve implant and then go back to school 3 or 4 days later. For a child, say, born with a complex kind of heart disease, in the first 3 or 4 years of life, they may have had 2 or 3 operations. And then when they get a bit older, 9, 10, 11, 12, early teens, having already had the chest opened for open heart surgery on 2 or 3 occasions, it's a more hazardous, more difficult operation to put in another valve. If you can do it without having to open the chest, the benefits are absolutely huge, and the results are as good as open heart surgery. What never ceases to amaze me are the advances that we make. Had you asked me 15 years ago to predict the future, I would never have predicted that we could be putting new valves into older children. So life is full of surprises, and there continues to be new procedures and also better equipment. So the better imaging that the new biplane lab systems provide enables difficult procedures to be done better, to last longer, and also to use other imaging modalities such as magnetic resonance imaging, CT. We call it image integration, and 3-dimensional reconstructions are now used, so you see the heart in 3D rather than just in 2-dimensional. Some people ask me, what are the greatest challenges that you face? Well, one of the interesting challenges is that increasingly we're seeing premature babies born with heart problems. They might be 1,200 grams, they might be 1,500 grams, they might be 2 kilograms, but very small. And can you do procedures on these tiny babies? And we are moving into the era now when we are performing procedures on newborn babies who are premature and tiny, whom in the past would not have been able to survive at all, or would have been treated with open heart surgery, which is unbelievably high risk, open heart surgery for a baby less than 2 kilograms. So some things we are now able to deal with in the cardiac cath laboratory, and again, new precise imaging is a thing that's going to make a big difference to that. So I guess some of you might wonder, well, you've been doing these fancy procedures in the past, why do you need new equipment now? Well, one of the things to emphasize is that to equip a cardiac cath laboratory is unbelievably expensive. The equipment lasts for about 5 to 10 years. Remember, you're using it every day, and the equipment, of course, gradually wears out and degrades. And once you're starting to replace things, of course, then you have to move into the next era. You have to have the equipment which allows you to do all the procedures in a better way and more safely, and also to be able to do things that you might not have been able to do before. The modern cardiac cath laboratory also is a wonderful teaching tool. to demonstrate with very good imaging, including 3D images, of course, enhances the learning experience. And the modern doctor is very good at looking at 3D and learning from it. So good equipment does allow you to do very good teaching and education, which is crucial, of course, for future generations.
Now that you've heard that amazing story from Dr. Mike Rigby, I'm asking you to help us with our Life in Focus appeal. Dr. Mike Rigby and his fellow clinicians have been treating babies and adults in Cath Lab 2 for many decades, but they are desperate to get the very latest in imaging equipment. So I'm asking you to help us with our Life in Focus appeal so we can put even the tiniest hearts into even greater focus. Please go to rbhcharity.org and look for our Life in Focus appeal, and any donation you can give would be very welcome.